It's been described as radical, an idea that could mean what is a national health service will suddenly feel more local, because for the first time the health and social care budget for Manchester could be handed over to councils in Manchester.
Well, we have a national health service with a national mandate, national targets free at the point of use, but we also want to have people in Manchester having greater control over their own affairs, and we want to bring social care and the NHS closer together. So it's a very exciting development, and it's part of the Northern Powerhouse, part of the future of the NHS.
So how would it work? Well, it would see control of Greater Manchester's £6 billion health and social care budget handed over to local politicians, including a yet-to-be-appointed Metro Mayor, clinical commissioning groups and NHS trusts. If approved, the changes would come into force from April 2016. Devolved power is something Manchester's getting used to. Here they've already accepted taking over responsibility for transport and house building. But this would go even further, and some are concerned it's too big a change.
If the idea is to get local authorities and the local health service commissioners working much more closely together to look at how the total pot of money is used, that's one thing. But if the idea is to transfer the whole NHS budget lock, stock and barrel to local government, that's a very, very big set of changes. That's very bold, very radical and very risky.
Councils across England already look after social care, but this plan would see funding for GP surgeries and hospitals in Manchester also under council control. But at a time when the NHS is under pressure, there are fears it will only add complications.
This sounds for all the world like yet another reorganisation, and that's the last thing the NHS needs right now. They're going to create another layer at Greater Manchester level, and I don't think that's what we should be doing. The second problem is this is a deal that's only being offered to some parts of the country.
For now, all the focus is on Manchester, but a bold move or a risky one, the government will be hoping it's a gamble worth taking.